It's amazing. Did you watch them? No. Yeah, I haven't come to my house. Tiny fruit. Lay everything out, put everything out. They all do their thing. Thanks.
Dealing with something that I don't like now. What I want to do.
I think we're going to go ahead and get started. I know this is graduation day when there's just all kinds of terrible rumors of awful traffic and demons descending upon us, and yet we're still all here. So congratulations to us for making it in. I think we have a number of people on WebEx today as well. But I really want to thank you for coming, and I think this is a super interesting topic that we got a lot of feedback from the surveys that you all sent us at the end of the session. And so this was one of the topics that was recommended that we cover, and it's basically communicating your science. So before I get to introducing our speaker, speaking of that survey, please, when Barbara sends it to you at the end of the session, go ahead, click on it. It should take you roughly a minute to give us your feedback on today's session, and then to also let us know what you want to hear about next semester. This, as you all know, K-Club is co-sponsored by Department of Pediatrics, Department of Medicine, the Georgia CTSA, as well as the Center for AIDS Research. So you are all our constituents, and we want to make sure that we cover topics that are most interesting and relevant to you as you build your research career. So at the end of that survey, respond and let us know what topics you'd like us to cover next semester. And as an incentive for doing so, we raffle off exclusive K-Club mugs. These are limited supply, let me tell you what, okay? So get them while they're hot. We enter your name into the Crown Royal bag that's really apparently the K-Club bag now, and we'll do a drawing on everyone who gave us their feedback. What's in here? Batteries. Okay. And you'll be entered into the drawing, and whoever our guest speaker picks, you'll win the K-Club mug. You do the honors. You get to pick.
Oh.
The future rests in
your
fingertips.
The paper or the box?
Not the bottom. Yeah, his batteries in there. Yeah.
Right.
Okay. Thank you. Oh, this is a person who always gives us great feedback, Amanda Thomas. Amanda here today. Oh, yay. Thank you, Amanda. We really appreciate all the feedback you always give us. Congratulations. Thanks. Okay, so for today's topic, it was a little bit challenging to really try to figure out exactly how to present it. So it's on presenting your science, and it's a presentation mode, so a lot of pressure on our guest speaker today, but I think that he is up for the challenge. I'm really pleased to be able to introduce Ihab Hajjar, who's Associate Professor of Medicine and Neurology. He's an internist and a geriatrician, and a director of the clinical trial unit of the Gosweda Alzheimer's Disease Research Center. His research is focused on the link between hypertension and vascular disease with brain health. He has multiple R01s and research projects from the NIA, and has published extensively on ways to prevent cognitive decline, and has also pursued investigations exploring potential therapeutic modalities for early dementia. He was recommended to us because he presented something very similar to the medical students and received rave reviews in his ability to communicate to you how to communicate to your science. And I also want to, even though he won't like me for this, I want to give a little shout out to Quinn Eastman in the back in the red, who is from the Emory Communications Office in the School of Medicine, and is also here just in case you have questions about press releases and things like that we'll dive into a little bit. But just as a reminder, we like to make K-Club super interactive, so if you have questions along the way, please raise your hand, and please join me in welcoming Dr. Hajjar.
All right, thank you. Thanks for the invitation and for the opportunity to talk about this. I really would like this to be informal. I am not that far from having a K, about 10, 12 years, I guess. So that's, I don't know, the grand scheme of things is not that far, but I was in, not so long ago, dealing with the idea of moving from my kind of junior situation to more senior situation, and I can tell you publication and presentation was very critical in that transition, especially when it comes to grant review. So publication is really our currency, and in our way we are valued or reviewed in multiple venues in almost all aspects of our career lives. So I think it's very important to gain those skills early on and hone them. So I can't claim that I am the expert or but I've published few, and I've debated reviewers and been on the other end of being on peer review. I've reviewed grants and papers. I'm on editorial boards. So I can give you slightly a dual perspective of being the applicant and being the reviewer, so to speak. So the second thing I'd like to say is I apologize if some of these components of this presentation or elements of this presentation seem too basic. I kind of made a kind of a guesstimate where everybody would kind of have a common level. So if it's something that you all feel I should not dwell on or focus on, just you know, raise your hand or let me know, and I'll just pass it through quickly. All right, the next thing I need to do is move these slides, and I'm assuming is it through the left button?
Yeah, I think
okay. All right. Okay, cool. So just a couple of general words about publication or presenting science. We've all been through this at various levels. We can present our results or research either through a formal dissertation to get a degree, or through other means to get notoriety and credit for our academic level. We can publish in journal articles. We can write books or book chapters. We can be part of a clinical research or other types of research. You probably have written technical manuals, user guide for your experiment of choice. Probably most of you, if not all of you, have written a research proposal. So that's a lot of the rules that apply in publications in journals and manuscripts apply very similarly or in a great extent in grant proposals. And then we try to present at national meetings or teach others in a classroom. So there are a lot of ways we communicate our science, and therefore learning the kind of the guidelines or the best practices to present yours would be important. So why publish? I don't mean to preach for the choir here, but publishing is necessary. It is the way we communicate science. It's the way we display or relay our discoveries and our findings in our research. In certain aspects, it may be good for promotion or critical for promotion or for graduation. And we are definitely not only reviewed based on our number of publications, but also where we publish and what we publish. All of these kind of factor into our evaluative process as academicians. What kind of articles one can publish? The kind of gold standard is to publish your research in an original research or a full article. This usually has most of the details so that it can be replicable by others and include the most information so that peer review can be thorough and successful. However, there are other ways where we can relay our science and our findings. If it is a critical finding that you don't want to wait till you get through a full article and get the peer review and the timeline of that. One can publish their findings in a rapid communication if it has some critical value without having to go through the full article. Review papers are other ways where we present some of our science. However, in general, these are reserved for summarizing what's been done rather than presenting new or original findings. They do carry somewhat of a lesser impact, with a couple of exceptions. I think meta-analyses, because of the amount of effort and novelty of or the new findings that you might get out of synthesizing the literature and combining it statistically, you might get one might get a slight higher impact in terms of the authorship of a meta-analysis than a review article. But there have been many examples where leading journals, JAMA, New England Journal of Medicine, others have published original articles, full original articles as meta-analyses. So it's an important part of the different armamentarium that we have in presenting science. Then you have case series and case reports. These are generally related to a rare syndrome or a rare presentation, but not always. For example, in my field, Alzheimer's disease, there's quite a bit of case series about the effect of certain drugs that are in use on cognitive function. So many of the, or few of the kind of repurposed trials have started off with case series where a scientist or a clinician observed there's an effect of a group of drugs on cognition and publish that, and then subsequently trials were initiated. And then finally, these are important. They usually are not specifically very relevant to one's career, but they're important. There definitely is important if you are asked to be on one of them. That usually signifies that you have reached a level where people are going to listen to what you say about a certain condition. So if you are part of a position statement or a guidelines or a consensus, that generally is a statement of your or of one's stature in the field. Example of commonly used consensus statements and guidelines is the JNC 8 or JNC 7. These are guidelines for hypertension. They're issued every few years. Almost every key person in the field of hypertension is on that. And then there are organizational statements such as American Heart Association or ADA or others that release these statements every now and then about a specific component. So, or specific feature. So these are by no means the exhaustive list of articles you can publish, but these are the most common that you would see if you are applying for a journal or a news or a magazine or a other types of publications. These are the general categories of things that people are looking for. One key element that I always like to mention to people who are working with me is that I always like to look at my paper before I look at my, or at least envision my paper before I envision my study. And that is because a lot of things that you would come to need when you are writing, when you sit down to write your first paper or your first research paper based on the study you've done, and that's from personal experience. A lot of things I should have done that, could have done that, should have done that, should have measured this, should have measured that. These are questions that I have dealt with on many occasions, and therefore, a lot of times now when I'm starting a new study or writing a new protocol for an experiment or a trial or what have you, a lot of times I would have a kind of an idea of what things I want to put in that paper so that I don't have to go back. I don't have to feel that, okay, well, I should have measured this and that and the other thing. So it's very important to to think about your paper early on in the inception of your research study. But having said that, a paper cannot fix your study. So you cannot fix a poorly designed study at the level of publication. In fact, it's the other way around. So you have to have a good, clear research question when you're designing the experiment. And the methods need to be very well defined early on. You need to have an appropriate design for what the research question is. That's a common reason why grants get turned down, in the sense that we have a great hypothesis, but then when we get to the methods, the design of our study did not really test that hypothesis. I've received that feedback on some of my grants, and it's for me a big lesson. So it's important to know that, or to be clear or cognizant of that possible limitation. Asking a statistician to help you with the study early on before publication is also very important. A lot of perspectives that we don't have as researchers, statisticians have, and therefore would be helpful at this stage of your research planning. I like to have pseudo tables. Almost for all my studies now, I write I put a results section, which is basically the table section. And you'll be amazed how many things you would find out that you didn't include in your protocol or in your experimental design that you find out that you need to have in your study. And once you get those pseudo tables and you figure out, oh well, I should have probably measured weight and height on multiple occasions rather than just at one time, or measured blood pressure, at baseline and at 3 months instead of just at baseline, etc. As researchers, it's very important to make sure we have transparency. So documentation of how we do things is extremely critical nowadays, and it's always been critical, but it's even more scrutinized now. So training, data collection, SOP, how you do QCing and review, and your database versions, etc. All of these issues are going to be very helpful if you have them in place and well thought of before you sit down to write your paper. Again, it's very important, and it's very difficult once you get your data collected and you're writing and you're doing your data analysis and you find out, well, some of my blood pressure were not done the right way, or my blood pressure was done at various times of the day rather than were done consistently at the same time, etc. So that's very important to think about these things before publication. And then something that is not commonly done is to have a data analysis plan, and that includes what is your outcome measure, what are your predictors, what are your covariates, who's measuring them, at what time, even to the point of selecting your statistical procedure. Am I using a chi-square or a mixed model or a t-test, etc. All of these, if you design them early on, you're going to have a lot of time efficiency at the end of your study. All right, enough of that, and let's move on now to, okay, you got your study done. My data is collected. I got the results from the statistician or the data analyst I'm working with. So now I need to sit down and write up my report. So first question is, if you are, try to exchange or in your mind places with the editor. So if I'm the editor and I get a paper from me, why would I publish that? So these are things I kind of try to answer. It's not always, a jackpot, but it definitely is helpful to frame it in that sense. So is it new and interesting? Not every study that you're going to do in your career is going to be new. To you, it's probably everything is interesting that you do, but to the editor, maybe about 10% or maybe less. I don't know. It's just a guesstimate of how much of that stuff they receive is interesting. So try to convince them that what you've done is interesting is very important. Is it relevant? Is it hot at this point, or is it something that people have done umpteen times and you're just adding to the number of people that have published in this area? Is there a certain significant problem that you're resolving, or you're just describing what you've done? And if it is not a new solution, which most research is not a new solution for a problem, what is it that you're contributing, and why would the editor say, well, this is important, I need to reserve space in my journal to publish this paper? Most importantly, I think what the reviewer or the editor is thinking, how am I going to increase my readership? How am I going to increase people citing this journal I have? How am I going to increase people going to PubMed and downloading these articles? So think about it. Think about how you frame your results in that context, and that's extremely helpful to think. So think of yourself or your paper as kind of you're a salesman. You're trying to sell your paper just like somebody's trying to sell a car. You're trying to convince the person or the client to buy this car and sign off on it right now. And I think that's what how we publish, is to try to present the best case to the person responsible to making that decision. All right. Obviously, not every paper you submit is going to be published. The majority of papers don't get published, and at least not the first time. So people have there are many reasons why you don't get published, and there's been some statistics published in the past about why papers get rejected. And the consistent finding in almost all these results is that the most common reason why papers don't get published is really related to the method section. There are other reasons, obviously, the significance of that. Poorly written paper, a lot of typos, very complicated, difficult to follow and all that. But by and large, most common reason why people get turned down is related to the methods, the design of the study. And that includes, to a certain degree, your sample size. So sample size and the way you describe the methods is a very common reason, if not the most common reason, why people get turned down for publication in the first attempt. But listed here are a bunch of reasons. I think you could easily follow through here. And they're, at the top five, I think if you pay attention to these top five or top six, I guess, then you probably address or lower your risk of getting rejected first time by quite a bit. Any questions so far? All right. So when I'm trying to publish the paper, the first thing I want to know is who is my primary audience? And that kind of relies a lot on obviously the research question that I'm asking. If it is a general audience, if I'm thinking about, new ways to prevent HIV at the level of the community, then this probably could fall into a general audience. It could be if I'm publishing something about a new cancer therapy or other things that will have a high impact at the society, then that general audience might be the appropriate audience because it has a very high level of impact at the science community. But as you kind of narrow down your topic and your research question, then your audience become more and more limited, and therefore your likelihood or chances of publishing your paper becomes higher as it is closer to the topic that you are trying to address. And I think of kind of papers or researchers studies that I've published. kind of higher impact are those that have a general kind of community-based or societal questions. You know, for example, in JAMA, I published things about hypertension prevalence or number of control, or some new finding, or in the Alzheimer's world. In the Alzheimer's world, for example, I haven't been able to publish in JAMA, although I have tried. So it seems to gravitate more towards a specialty journal. So I published a few in JAMA Neurology, or in Neurology, or in circulation or hypertension. So these are papers that are more specific about a disease that probably a lot of people would be interested in, but for the most part, the most interested people are the people in the field, of my field. And then you can go into a subspecialty, and then go to a subspecialty. You know, I think it's just nowadays you could the sub is like 3-4 levels of subspecialty. For example, we have there's, for example, MRI journals, and there is a DTI journal, which is a modality of MRI, and then there's a connectome journal, which is a journal that analyzes DTI. So you get the picture here that there's a lot of subspecialties that you could publish in. Obviously, that will impact the impact, I guess, of your paper. The more you publish in a general audience paper, the bigger your audience is going to be, and the higher the impact of that article will have. So how do you pick? You could look at your references and see which are of your references which of the journals in your references that have been quoted the most. That gives you an idea that maybe my article is appropriate for that journal. There are certain tools that you can go to from the main publishers, like Springer or Elsevier, and you could put in the title of your paper, and it will give you here are the list of journals in our catalog that might be appropriate. Helpful. I haven't used it much. I've used it a few times. Between you and me, I kind of use it when my paper gets rejected a couple of times. So you get to kind of start thinking about some of the journals that you don't think of right away. Looking at articles in a candidate journal is helpful. So looking at, okay, I'm writing a paper on atrial fibrillation and stroke. So has anybody written anything recently similar to that or remotely related to that? And that could be positive and negative. I'll give you an example. We wrote a paper recently on the racial differences in CSF biomarkers in Alzheimer's disease, and we were planning to submit it to JAMA Neurology. It was submitted to JAMA Neurology, and then right before we got the review, they published a very similar paper from a group in Washington, University of Washington. So we're like, oh, well, maybe they will, maybe they won't, but they turned it down. So I think it's because they published a paper similar to it, though they didn't say that. But anyway, I think it's important to know where the editor's mindset or the editor's mindset is in terms of the field. They will help you decide whether you want to move forward in that journal or not. But I definitely would kind of limit my publication to stuff that is peer-reviewed, that is in PubMed, obviously. Some papers are known, or journals are known to have extremely long time between the time of submission and the time of publication, so it's good to know those, and looking at the impact factor. As a rule, we should never submit to more than one journal at a time, but I do have a kind of a trend or a tendency to pick 2 or 3 journals that I'm planning to send my papers to. So although I don't submit them simultaneously, it's always good to have a plan B so you're not thinking afterwards where to go when you get the rejection. Okay, you're all familiar with the impact factor, right? So it's kind of the universal measure of how impactful the journal is. I want to kind of poke some holes, I guess, in the impact factor. One of them is that it is very biased by self-citation, although there's, I think, a trend in more recent calculations to avoid self-citations of journals, but it is biased by that. It's also biased by the number of, or by specialty versus general audience. And the smaller the field, the less impactful the journal is. So if you're publishing in the, I don't know, the Journal of the Right Atrial Fibrillation, it's going to be less impactful, even if it's a very good journal, than circulation research, for example. There are other metrics that people have used. There been a lot of attempt to try to counterbalance or to address some of these limitations of the impact factor. The other limitation of the impact factor is that it is really looking at the 2-year period. So it is, if you have a paper that's been cited many times, 3 years ago, as time goes by, or as a journal that has been very popular and then started losing popularity, the impact factor becomes less and less over the years, which may be a good thing for looking at impact in the field. Other things that people have used, these are journal level metrics. The eigenfactor is something you can now get on a lot of journals. It measures the overall importance by not only counting a 2-year period, but also a 5-year period. The side score is another thing that you can obtain. It's not as easily obtained as the eigenfactor or the impact factor, but it basically addresses the time frame limitation of the impact factor. It also tried to address some of the issues about the problems with the field size, so it tries to normalize some of these measures. And I haven't seen these used very frequently. They've been out there. Are you guys familiar with those? Have you seen those? They're not as, at least when you're up for review on your committee, H factor, the impact factor is probably the most, one that's been looked at the most. Anyway, so other metrics, there are ways we analyze or evaluate authors based on their articles, the so-called H index. You're familiar with the H index. And the H index is basically it's a simple metric. It's basically the total citation generated from individual author publication based on the most cited articles. So you rank your articles, and when you get the citation that is less than or equal to the number of that article, then you get the H index. And then the NIA a while ago came up with the article level metrics, which is a relative citation ratio. These are based on some measure of how much the citation is received divided by the average citation per year. It's really limited to NIH funded, although this could have a application in other types of funded research, and it's usually a benchmark is 1. Anyway, I just wanted to mention these just to make you aware that there are other measures. I think as I do, and almost everybody that I know does, is when you're trying to decide on your paper, you're really Googling impact factor, journal name, and then finding out if you should publish there or not, which is a totally reasonable way to go. All right. So now I've decided where am I going to send my paper to. Next thing is like, I got to have to sit down and write it, right? So that's the hard part. This is a way I have kind of done it, but it doesn't mean that's the best way or the only way to do it. But I think it's always good to figure out a way that helps you get your most efficient way of publishing or writing the paper. I think probably there's a step beyond that, is the pre-contemplative or the contemplative stage, I guess, where you actually have to prepare yourself. I'm going to have to get some time to write, right? So, and as you get busier and busier, that seems to be the one that kind of falls off the on your calendar. You know, you got all the other things, patient care or your whatever your classes you teach, your grants that you're writing, the trainees that you're training, and writing is always kind of, at least for me, seems to be the one that, well, I can do the writing tomorrow or the weekend or night or whatever. But I think getting a time on your calendar dedicated for writing and using it as a hard appointment that is not negotiable, as much as you can afford to do that, is really helpful. All right, so start off with your abstract. It's a draft abstract. And then the next thing is to get your figures and tables, your methods, your conclusion. And I always go back to the abstract after I'm done with the paper. One trend that I observe through the years is that a lot of people leave the abstract to the end. They're focusing a lot on their methods and results, and the abstract is kind of the last 5 seconds before you're submitting your paper. And that I think is it doesn't do justice for your method, for the message you're trying to give. The abstract, I think, is probably the most critical step in peer review. That and the title. So the title is really your opportunity to, you know, and I kind of think of the title as you're driving down the highway, and you have these boards that you see, you know, ads about things. There are certain boards that, or bulletin boards that kind of draws your attention, right? And some you just glance through and you just don't remember a second after what that's about. So the title is kind of like that. It's kind of like this flashy thing that's going to grab you and say, "Oh, I remember that," you know. This is really your opportunity to attract the reader's attention, and in that case, your editor. It's informative and concise. We've seen titles that are 3 or 4 lines, and it's basically just trying to describe the whole results in the title. And then there are titles that are 2 words, you know, AFib and stroke. So it's, I think there's a way in between. I think of titles, there are 3 ways you can describe your paper. One is declarative, which is basically, I'm going to share with everybody right off the title, what are my results. So this is my attempt at humor, so I apologize if it's kind of lame. But example of a paper is that the restaurant clients prefer hash brown over fries. So your study is looking at hash brown versus fries, and you found that people prefer hash brown, so this is your title. It could also be descriptive. So your description is, this is what I did, and what I did is a survey of people coming to the restaurant. I titled my paper, A Survey of Restaurant Clients' Preference of Hash Brown versus Fries. Or, which is a common practice as well, is to ask the question. And by asking the question, you're basically telling the reader, think about this, which one is better? Is it this or that? If a person is, a reader or editor is interested, then the question might be a good way of piquing their interest. I don't know if there is, and I think a lot of people have kind of thought about this in the field of publication. whether one is better than the other. In generally, the teaching is that giving people the results of your study in the title is probably a good idea, but it's not always the best way to go. So you kind of have to think about what is the best way I can capture people's attention. Okay, so the abstract, I'm kind of in an analogy mood today, I guess. But the abstract is more like your movie trailer. So it's basically the way that you're going to get people to come see your movie, and that is very important. So it should be, it should stand alone. So it should describe, but not necessarily offer a judgmental statement on your study. In your abstract, you wouldn't say, well, this is the best study that ever been done in this field. That's not a good idea to put that in your abstract. It turns people off, and it's probably not appropriate. Very brief statement of the problem. I see a lot of abstracts that they have 5, 6 sentences on the background and very limited on the methods and results. So that's not a good practice. Describe the research method and design. One common thing is use abbreviations and definitions of measures that you haven't defined in the methods portion of that abstract, but then you have all kinds of abbreviations in your results, assuming that the reader is going to know these abbreviations. So that's probably not a good idea. Remember, it is a showcase of your work, and again, almost all movie trailers pick up the best scenes in their movie and put them in the trailer. So that's also important for your abstract. The key impactful results, and putting other things that are probably important to the paper but are not necessary for the abstract is an art by itself. And I think sometimes you have to think about, if I'm going to put some data point or some result, is it distracting from the main message that I'm trying to deliver, or is it important and feeding off my main message that I'm trying to say? One issue that's true actually for grant applications as well is you read the specific aims or in a grant or the abstract of a paper that's submitted, and then they say there's a description of some metric, and then you go down to the body of the paper and the results are completely different. People have forgotten to go back to the abstract when they corrected their results, go back and correct the abstract. So that's why it's important to go back to your abstract. And typically what I do is I highlight every number I have in my abstract and see where it is in my paper. You don't want to have anything in your abstract that is not in your paper too. So you don't want to have a paper where the main finding of effect of drug with the p-value being in the abstract but not in the paper. All right, I'm gonna kind of speed up a little bit. So introduction, this is probably the one that people spend the most time on, which is probably the one that reviewers read the least. The goal of introduction is not to summarize the field. It's not a literature review. It's not a history lesson. It is basically the only goal for the introduction is that by the end of the introduction, I'm going to convince you that this is the best study done, and that is, not the best study done. It is the most important study done, and therefore you're going to have to read the rest of the paper. So there is spending time on the introduction is important, but not to basically just summarize the whole field, but also to kind of give a story. This is a story that by the end of paragraph 2, and I say paragraph 2 here because it's probably a good idea to keep your introduction to 2 paragraphs, but that's not really written in stone. I think if there is enough background that you need to give people so that they are convinced about your research, then by all means. The method section, so think of the method section that if I am a novel to the field, if you are writing a paper on using, I don't know, some intravenous injection to rats or to mice study, that if I pick up that paper along with the supplementary material, then I'm going to be able to go to my lab and do the experiment. That's how I think of methods. I don't have to call the author, for the most part, I don't have to call the author and say, what exactly did you mean by you gave these rats, the usual dose of this drug or that drug. The other thing that's important in your methods is to, and I find that very helpful, is to look at some guidelines that have been published and accepted about the elements of a paper that is related to the design of your study. So we're all familiar with CONSORT, right? So CONSORT is the national, it's not national, international recommendations for how to present clinical trials. It's been in effect for many years. I've had many revisions. I think it's very hard to publish any clinical trial now without having a CONSORT figure and some elements of the CONSORT. But there are other areas that have followed suit. So for observational studies, there's the stroke guidelines. For animal studies, there is the ARRIVE guidelines. And for meta-analysis and systematic review, there's the PRISMA guidelines. And I put those references here. You don't need to go over all of these, but it's always good to keep a copy of those. The nice thing about those websites is that they give you a template. So you can download a template and just fill in the elements, and it gets you all the elements that you need to give. On the opposite end of the spectrum is the writer who is putting 5-6 pages of methods into their paper, and that is especially in highly technical papers. So that is kind of turn reviewers off. And if there is a highly technical, especially equations and stuff that are not necessarily critical but are important to mention, take advantage of supplementary materials. I mean, I think almost every journal now allows for supplementary material. All right, moving on. So results. In the narrative of your results, I think it's critical to not just refer to tables. So, one way to write your results is like Table 1 provides the basic description of my study sample. Table 2 provides the main study of the primary outcome, and Table 3 of my tertiary outcome. So that's not a good way of writing your results. So you want to have a story. So and the story should link up to your introduction and to your methods. So think about, okay, so you're having this is the climax of your research. So you've prepped up the reviewer or the reader to the importance of the problem. You've kind of did the plot line in the movie. You said this is what's going to happen. But now this is when you're going to say, boom, this is what I found. And that's why you need to publish this, because these results are going to answer the question that I had in mind originally. All results should have tables and figures. There's limitation on their number. I think most journals allow for 5, but others allow more or less. If it's a letter to the editor or something like that, and I think they allow like 1 table or figure. But look at the instructions to authors and see what they have recommended. Another area that I think is important is to think about the cost of publication. So if you are on a limited budget, as most of us are, if we publish in color, figures in color are very expensive. So especially if you are designing now slides and immunohistochemistry, or might be a different story. You do need the color to deliver the message. But in general, if you are creating a graph or something like that, you can probably deliver the same impact and the same message using black and white. So just be aware of that. Also, if you design your figure in color, and then, which has happened to me, and they're like, well, you have a $2,000 publication fee for this figure. I was like, well, publish it in black and white, and they did, and I was like, I should have probably put some thought into that before they turn it into black and white. Anyway, so this is an example of a relatively good result. So you have the, you're kind of orienting the reader to where you are in terms of your methods. Basically, you're looking at the effect of entrapment, efficiency. So that's presumably part of your method. So you've described what that is, and now you're matching it to your results. And then your basically your take-home message would be there, and then you would refer to the table at that point. And I just did this kind of quick example of this is how nice it would look like before before the editor or the journal turned it from black and white, and now it's here. So now it's kind of very difficult to follow. So think about line formats more than color as types of ways of differentiating your figure components. All right, finally, discussion. It should correspond to the results, again, linking to all the other sections of your paper. So you've provided the problem and the method in the introduction. You described how you're going to solve the problem. You provided the problem, the results of solving the problem, and now you want to summarize everything by saying, this is what I have achieved from this study. Common problem or mistake that I see is people introduce new things in the discussion. Especially says when people say data not shown in their discussion, I have a little concern about that. So that typically is not a good practice. It's always good to compare to published results. If your finding is in contradiction to the majority of or to some publications before, one way is to ignore it and say, people have found this before, and avoid mentioning anything about the opposing or confronting it and saying, well, our paper is is opposite to what other people have found, but our results are addressing these limitations that these other findings have found. Another important issue to remember is, and that has also happened to me, is you would say this is the first report that is saying drug X is working, and it so happened that it's not. And in fact, there's been studies to show that most people that claim their publication that this is the first report, it's not actually the first report. So try to use that very sparingly. And then overjudging your work is also another turnoff for reviewers. So try to use kind of factual terms, and just describe your results, address some of the issues that other people have faced and how your paper or your work has improved or changed, but don't oversell your results. This is, although I've used the car sale analogy earlier, it is not really a car sale. We have to substantiate, we have to make sure that any claim we do include in our paper is substantiated by evidence. Another, and that's the last point I'm going to talk about discussion, is that people in the discussion can, kind of have a mixed bag of introduction, methods, results, conclusions. So you get really kind of a head spin reading the discussion sections. Just be focused on what is you're trying to achieve.
You have about 5 minutes.
Okay. All right. last couple of things. So this is the peer review. You've probably known how that is. It comes to the journal editor. They decide on whether to send it out, and then it gets accepted or rejected, and then it sends back to you. If it is reasonably acceptable, then you were asked for a revision. When you submit your revisions, I think the take-home message is never to take it personally and don't argue with the reviewers. The reviewers are always right, at least in my opinion. If you decide you want to kind of go against the reviewer, I would try to say it in the most politically calm and docile way. So generally, this is how the paper would look like when you first write it. This is how the paper would look like after you've gotten through peer reviews. A lot of changes. You had to include things that the reviewer have asked you to. So I think it's okay as long as you don't compromise your study and your research. Then that's a positive way to get your things published. I'm going to skip that. I want to talk just a second about cautionary predatory journals. How many of you receive emails about predatory journals, from predatory journals? Yeah. So it's a very common thing now, and a lot of junior faculty and trainees fall victim to it. It is not really peer-reviewed journals. They're just trying to get after your money. So I think it's important to be aware of that. Just because somebody invited you to write, or somebody invited somebody to write a paper and said, we're honored to have you as an author, that doesn't mean that this is a peer review. And there's a website here that gives you some kind of guidance about what is a predatory journals and what they are. I also wanted to give you some guidelines about other ways to communicate our research, and that is oral presentations and posters, which is another common way of how we communicate. I don't have time to go over all the details, but I'm sharing with the group one guideline and a couple of presentations that gives you a detailed kind of best practice of how to write a poster and how to write an oral presentation, scientific oral presentation. So feel free to look at those and use them as reference as you are preparing your next meeting presentation, oral presentation, or poster. I think it's very helpful.
And we'll circulate those via email after today's paper.
All right, I think I'm going to stop here. The take-home message is the critical issues that I think we need to leave with is that our publication preparation starts early in our research activity, not late, and that there are certain guidelines that we can follow and help us what elements we want to include in publications, and some best practice about oral presentation and slide presentations are always helpful to give the best presentation possible. And I'll stop here. Thank you. We have 2 seconds, I guess.
Any quick questions?
2 minutes for a quick question.
I think you'll all find the what we'll circulate afterwards very interesting, so please read those and let us know if you'd like to hear more about this. Do you have a quick question? Oh, I saw your hand. Okay, great. All right, well, thank you so much, everyone, for coming. We'll see